Hi, I'm Kristen Cozier, and this is my daughter Gianna. She's 6. We are going to do the head to toe exam. I already washed my hands. I already introduced myself to my patient. So, this is Gianna. She appears well proportionate, well nourished. She is dressed appropriately for being inside the house. You can say hi. She wants to say hi.
Hi.
All right. So, also, her facial expressions and affect are appropriate. Now I'm going to take a look at her skin. So I can see that she is tan in color. She is warm to the touch. Her skin is dry and smooth. She does have some abrasions to her right upper arm, her left upper arm, oh, her left lower arm, sorry, and an abrasion to her hand. Other than that, there's no lesions. You're not tender anywhere. You're not having any pain. I'm going to take a look at your head. So it would appear as though your hair is evenly distributed. Her hair is shiny, brown. Doesn't appear like there's any infestations. Can you look down? Good. Her head is normal cephalic. I'm going to feel. Tell me if anything hurts. Nothing hurts? Oh, sorry, I pulled some hair out. That's why that hurt. So there's no masses, no tenderness. Right? Okay. Okay. Good job. Okay, now I'm going to take a look at her face. Her face is symmetrical. Everything is symmetric and midline. Um, I would say there's a little abrasion right on her right cheek, a little nevi on her left cheek. Her skin on her face is warm to touch, dry and smooth. Hair is evenly distributed. I'm going to take a look at her eyebrows. Can you look straight at me? Good. So look straight. So eyebrows are evenly distributed. No lesions, no infestations. And then her, you close your eyes. Good. Open them. So her eyelids cover her whole eye. They're intact. There's no lesions. I'm going to look at your eyelashes. Can you look at your eyelashes? So eyelashes are evenly distributed. No infestations on the eyelashes, top or bottom. No lesions. Okay, now taking a look at her eyes. So the sclera is white. Down. Conjunctiva is red and moist. There is no lesions. The lacrimal puncta is moist, pink. No excessive tearing or dryness. No lesions. The irises are brown. And the pupils, we're going to take a look at the pupils. Pupils are black. In this light, this room is kind of poorly lit, but I would say her pupils are about 6 to 7 millimeters. Okay. And I'm going to take a look at, oh, you know what? I need to test your facial nerves. Yes. So facial nerve 5. Can you smile? Can you frown? Can you puff out your cheeks? Can you close your eyes real tight? Good. So her facial nerve 5 is intact. And then I'm going to feel here. Any pain? Close your eyes. Any pain here? Any pain when I touch here? Okay, good. So now I'm going to test. Okay. So now I'm going to test for the sensory of facial nerve 7. So this I'm going to show you. It's either going to be soft or it's going to be sharp. I'm going to have you feel right here. So this is sharp. This is soft. Okay, so close your eyes. Tell me if it's sharp or soft.
Soft.
Sharp or soft. Sharp or soft.
Sharp.
Soft or sharp. Soft or sharp.
Sharp.
Soft or sharp. Soft or sharp. Good. So that cranial nerve is intact. That's 7. Good. Okay, now let's get back to the eyes. All right. So I'm going to look at using the pen light, making sure the cornea and the lens are clear. And they are. Good. And then we're going to do where I'm going to shine the light and I'm going to watch both eyes, okay? So direct and consensual on the left eye. Good. Direct and consensual on the right eye. Good. Okay. And I'm going to take a look inside your eyes. Okay. All right. It's going to be a bright light. Okay. But look straight ahead, straight at me. Actually, look over my shoulder, okay? Ready? Good. I see the red reflex. And that's good. I'm going to do this other eye too, okay? Look straight over my shoulder. Good. Sorry if that's bright. Yeah, okay. So we are looking and I see the optic disc. That's like a yellowish orange ball. And I see the red reflex. And I also need to test with my pen light. Physiologic cup. That is about 1/3 of the optic disc. I do need to test. Okay. Oh yeah, I'll do that. Okay, ready? Look right at me. I'm going to follow the pen light. Good. Try again. Good. All right. So now we're going to test the cranial nerves 3, 4, and 6. So you're going to follow my pen light again, but you're going to look at me. Okay? So follow it up. Don't move your head, just follow. Follow there. There you go. This side. Go. Okay, now we're going to do the other side. Up. Side. Are you getting tired? Is this boring? Lower. All right. So, yeah, your cranial nerves are intact. All right. So we are going to do the cover and uncover test too. Okay. So I'm going to put this over your eye. You're going to leave your eye open though. Ready? We'll do the right side. Just look at mom. Good. Good. One more time. Good. Just want to make sure. Good. So there's no misalignment with that. Now we're going to move on to the nose. I'm going to look at your nose. It's midline. It's symmetric. There's no lesions. I'm going to see if your airway is patent. So I'm going to have you breathe in. Can you breathe in just fine? Good. Good. We'll test cranial nerve 1 right away. Okay. So hold one nostril shut. Close your eyes. Tell me what the smell is. Good. Okay. I'm going to do it one more time. Tell me what that is.
No.
Okay, good. So cranial nerve 1 is intact. And then I'm going to take a look inside your nose here. No, why isn't this working? It's okay. I'll use my pen right. So mucosa is pink and moist. Yeah, I know what I mean. Pink and moist. Doesn't look like there's any lesions, any tenderness when I touch. No. The septum is intact. It's midline. Now look at your ears. All right. It's just working. My otoscope is not working. It's just working. Well, we're going to pretend, and I would tell you what I would see. Okay? I'm going to look at your ears. They're symmetric. The lateral canthus, the ear is above the lateral canthus. Okay? There's no lesions, no masses. Does this hurt when I press? What about when I pull down? No? There's no pain? Okay. So I'm going to look inside your ear. All right. So I don't know what's wrong. This was working. Of course, no, it's not. So I'm going to look inside your ear. If it was working, I would see that the tympanic membrane is intact, not red, no redness, no swelling. We would also check on the other side. I'll go check on the other side. Again, so I would see that there's a little cerumen, there's a little hair, which is normal. It's okay. And then I would see that there is it's pearly gray, it's convex in shape. There's no discharge, it's not bulging. Thank you. And now we're going to do the whisper test. Okay? So I'm going to whisper something, and you have to tell me what I said. Okay? So we'll do the left ear first. Good. Good. Okay. So now I don't have a tuning fork. If I had a tuning fork, I would hold it at the bottom. After I have it vibrate, I would put it on your head. I would ask if she hears it. That's the Weber test. And then I would do the Rin test, or Renee test. I would hold it after it's vibrating, put it on the mastoid bone. I would say, tell me when you can't hear it. And then when she couldn't hear it, I would put it in by her ear to listen for air conduction. And I would do that with both ears. So then we're going to look at the mouth, and we're going to look at the lips. So the lips are pink and moist. And can you open up for me? teeth. So she has some missing teeth on the top here. Looks like on the bottom there's missing teeth. One adult tooth is in and another one is coming in. And then I would feel, I know there's some loose teeth in there, right? I would be wearing gloves too, by the way. So also look at the heart palate. That's intact. There is no lesions. No, are you having any pain there? Good. No redness, no lesions, no swelling. Let me look at the bottom. Open. Good. Lift your tongue up. Good. So the soft palate is intact also. And when I looked at the upper, the Stenson ducts are not enlarged. And then also the, what is it? The Wharton ducts. Oh, you got a lot of wiggly teeth, huh? The Wharton ducts. Open up. Lift your tongue up. So that is also not obstructed. Oh yeah, I gotta look at your tonsils. Say ah, or actually let me see. Stick out your tongue forward. Good. So the tonsils are not enlarged. I would say that's a 0. I'd grade them a 0. There's no exudate, no pus coming out, no lesions on them either. And then I would like to test for cranial nerve 9 and 10. So I'm going to have you stick out your tongue. Stick it out. And then open up your mouth. Say, oops, stick your tongue out though. Say, ah. Good. So I can see that the uvula and the soft palate move when she does that. So also swallow. Good. So 9 and 10 are intact. So then I'm going to have you stick out your tongue again. Okay, you can swallow it. All right. So can you stick out your tongue and move it side to side? You stick it in your cheek. You stick it in your other cheek. So that is testing cranial nerve 12, and that is intact. So the other thing I want to do right away then is look at your neck. And it is symmetrical. Your trachea is midline. We'll test cranial nerve 11. So push up on my hands. Good. Now push against my face, my hand. Push your face against my hand. Good. And that side. Good. So that is cranial nerve 11, and that is intact. So I will be assessing for lymph nodes. Do you need a break? Do you need a break? Yeah. We'll stop and give her a break.